Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens, and how are you today?
I'm great, and yourself?
Well, I'm living it up. What about you?
I'm living it up because I learned it from you. And we want our listeners to live it up, so we're going to talk about how they can be pain-free, possibly, from musculoskeletal or orthopedic pain. That's what our show is about, basically, for the next hour. If you're in pain, like muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, disc pain, hip, arthritis pain, knee pain, elbow pain, carpal tunnel syndrome pain, basically orthopedics. Maybe you have stiff joints, dull aches, you don't know what's going on. Give Dr. Darrow a call right here, right now, 866-870-5752, right here at the station. And when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, actually. And you can also find information on the website, which is www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. Very exciting stuff if this is new to you. And again, our number is 866-870-5752 right here in the studio. You can speak directly with Dr. Darrow. It's like a free medical consultation, actually, in a sense, you know. And you can also...
We call this a curbside consult.
I like it. I like it. So we're here Saturdays at 10 a.m., again at 1 p.m., and if you'd like to call the office for very personalized information, billing and such, that number is 800-300-9300. That's 800-300-9300. That's the office. And again, if you'd like to call and talk to Dr. Darrow right now, we urge you to call early in the hour because the calls rack up at the end of the hour every week. I don't know why that is, but that number right here in the studio is 866-870-5752. What do you think?
I think it's time for me to answer some questions for people that have come in. And we can weave in what regenerative medicine is, which includes platelets and stem cells at this point. That's the best technology we have. And I've gone through, over the last 22 years of doing this work, all kinds of different proliferants, meaning things that stimulate tissue to grow and heal the body. But the most recent and the latest technology today is about using platelets from your blood and using your own bone marrow to get stem cells. And there are other ways to do it also, but that's probably some of the best. And I get questions all day and all night, emails and people calling in. And through my website, which Nita mentioned, is www.lastemcells.com. I'll repeat it for you while you grab your pencil. It's lastemcells.com. There is a spot on every page to email me, and I answer every email. It's a lot of my day answering emails, but I love it. I love communicating with people. And I'd love you to call in right now and talk to me. That's the best way to figure out what's going on specifically for you. And the number at the studio is 866-870-5752. And then you can also get a hold of me at my office and answer more questions there at 800-300-9300. So
Sounds
I'm
good.
I'm going to go to a question that says knee back.
Okay, but hold on one sec. Do you want to pick up Nancy before you do the question? She has arthritis
Why
in her
not?
knee. Okay.
Yes, Nancy, I see you on the call screener board. So, Nancy, my name is Dr. Marc Darrow, and your name is Nancy, and I really thank you for calling in. How long have you known you've had arthritis in your knee?
It's about a couple of years.
Okay. And how did you find out it's arthritis?
Oh, I go here in couple of doctors in Santa Monica and also Beverly Hills. Those both very old and experienced surgeon
Wonderful.
and knee therapists, and they both, after the MRI, the severe pain in the knee.
Okay. Do you remember what they told you about the MRI?
Yes, it shows. Even my son-in-law is a radiologist, and they all think the cartilages and everything is very bad situation with osteoarthritis. And during these 2-3 years, 2 times, the injection monovasc or the gel injection.
Sure.
And also on the one day before the New Year, they give me the cortisone shot.
Okay. So may I ask you some questions and speak a little bit about this now?
Sure.
Are you able to bend your knee and walk around?
Yes, but it's limited movement.
Okay. How far do you walk when you do?
How far will I walk? I walk with pain around my home block, but I used to go to the ocean and come back. Right now, it's just a block around my home with pain. The pain amount is different days.
Sure.
Sometimes it's 4, sometimes it's 2.
Okay. Well, here's the issue. If your knee is working, but you have pain, I can probably help you using stem cells. Okay? PRP also is helpful. PRP is platelet-rich plasma. If your knee is completely locked up, then there's not a whole lot usually I can do, but sometimes there is.
It's not locked.
Okay. So I'm not a proponent of surgery, so you should know that right away.
Right.
And the reason
Everybody says no surgery because I am only 65. But they told me both that because PRP or even the stem cell is not helping me for osteoarthritis. What do you think?
Well, that's why I said, please let me talk a little bit and I'll tell you.
Okay.
I got a lot to tell you already. So, number 1, hyaluronic acid, which is the Monovisc, I don't ever use. It's a lubricant. And most knees have plenty of fluid in them already because the synovial cells around the capsule of the knee produce hyaluronic acid anyway. When I treat with platelets or stem cells, that also produces some hyaluronic acid to lubricate the cartilage so the knee can move. So I'm not a proponent of hyaluronic acid. Number 2, cortisone is the worst thing you can put in a weight-bearing joint because the pressure on the cartilage with the cortisone, which is a steroid, will literally dissolve away some of the cartilage and give you worse arthritis. It makes you feel good usually for a little while, and then it comes back worse over time. So I'm not a proponent of any steroid shots like that. Okay? Number 3, I treat arthritis in the knee, the shoulder, the hips, the neck, the back, the toes, the wrist, the elbows, the ankles every single day. And I do it using platelets and stem cells with excellent results. It doesn't work on everybody for certain reasons, which I can explain. but it works on most people. And we have studies we do at the office. We have a 25-person research team, which is basically either college students or post-grads who are trying to get into medical school. We have some medical students that work with us also. And we have studies that show that these things work. Also, I have a book that you're going to get because you called in. We're going to send this out to you for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the reason it says don't operate is because I get new patients in almost every single day who have had failed surgeries. That means they had a surgery that made them worse. And unfortunately for me, I'm one of those people. When I was in medical school a long time ago, I had shoulder pain from a weightlifting injury, and I injected, let's start earlier. After the surgery, my shoulder and my arm blew up like a balloon full of fluid, probably a lymphatic, which is a vessel that returns fluid back to the heart. Probably was cut mistakenly, and so my arm was full of fluid and I had a high fever. I was terrified that I had a infection. I didn't. It's just that it took a long, long time for that arm and shoulder to go back to its pre-surgical state, which still wasn't very good. And then it took me a couple of years to learn about regenerative medicine. And I injected my own shoulder one night, and I woke up the next morning completely pain-free with full range of motion. To me, it was like Spirit came down and kissed me on the forehead and said, "This is the work you are going to do as a doctor." And I did. I started questioning my patients, "Can I please try this new thing?" Because it was pretty new back in those days. And most people said, "Yes, please try it." If it worked on you, it had worked on my wrist, and it had worked on my shoulder, self-injecting myself. And at that point, I started getting more and more patients healing from it. So over the years, I have...
Yeah.
Can I finish?
Yes.
Over the years, I have found, and I get, on average month, 60 to 80 new patients, that most people heal from regenerative medicine using platelets and stem cells. So I know that orthopedic surgeons don't believe in it, and that's fine. They have their own way of doing what they think is best. I don't like what they do unless it's something with a broken bone or something they have to operate on. I love them for that. I actually love surgeons. I just don't like when they do the surgeries that shouldn't be getting done. And there are studies that they did showing that if you do a fake knee surgery, that means where you just cut the skin and you don't go into the joint, that the results come out the same as a real surgery. So why do a real surgery? I'm being facetious when I say this. Go do a fake surgery. It'll be the same as a real one without all the problems. And I get people that come in all the time that have had failed surgeries that have made them way, way, way worse. And I was one of them. And that's when I knew, even though I was on track to become an orthopedic surgeon, I jumped ship. Okay, I jumped ship in the middle of the stream, and I found regenerative medicine to be the answer for me. I'm not saying it's perfect. I'm not saying it works for everybody. But at least, if it doesn't work for you, you haven't had a surgery with the possibility of infections and joint replacements that fall out later or cause imbalance and cause other parts of the body to be painful. So I'm a proponent of regenerative medicine. I have been for the last 22 or so years, and I have taught it at UCLA for all that time. And the young doctors want to learn about this. I have doctors come from all over the world to study with me. I'm what we call shadowed by students all the time to stay with me and follow me and learn how to do this. So I'm a believer in it. It doesn't mean it's for everybody.
Okay,
and I know the surgeons... go ahead.
My two doctors, both very old, over 60-something, 70, and they both before surgeons. And they both said, you don't need a surgery. And but these two scientific and very good methods that you have, let me ask you, Medicare will not accept it, and it's very expensive. And about 30 or 40% it doesn't work for osteoarthritis, isn't it?
It depends what works mean. The statistics we have from the studies we do shows it works more than that, but the problem often is with the patient, not with the treatment. And I facetiously say the patient cheats on me. That means we have every patient sign a form that says they will not exercise without my written consent. But that doesn't stop them from beating up the area that I'm working on and not letting it heal. Think about this. Nancy, if you did have a surgery and then you went and running the next day or playing golf the next day or whatever it is, do you think you're going to heal up from the surgery?
No, of course not.
Well, guess what? Of course not with my work too. But everybody cheats on me. And they come back and they go...
You mean they do exercise after your treatment?
Oh, yeah. Oh, yeah. Because it seems like it's nothing. They just walk in the office, they get an injection, they walk out, and they don't think a big deal about it, so they don't listen to me. They even sign something saying they're not going to do it, and they still do it.
How long after they should not do exercise?
I have them come in for a follow-up in 2 weeks, so that's the first time period. Then we reassess. We see if they need another treatment or whether they're good enough to go back and do their exercise or whatever it is they want to do.
So that's not bad. 2 months, 3 months, 4 months, no exercise is not bad.
Well, it's not usually that long, but it could be. If someone has severe arthritis, it may take a few treatments. If someone has a tendonitis or a ligament sprain or something like that, it's often very quick.
Yeah.
So everybody heals differently, Nancy.
So can you please tell me about this severe osteoarthritis that all of those cartilages and the capsules are gone and hurt? How many % of your patients got the treatment and they are happy? Really, how many %?
It's probably like you were saying, 70 or 80% of people say they're really good, but there's another issue to it, and that is how many treatments will it take? I don't know the answer. I know on my own body I've injected certain parts that have healed overnight, and then I've had other parts that it's taken a few months and many treatments. I never give up. But a lot of patients do give up and they say it didn't work. And that's because they didn't work it according to how it works. This is not a magic wand.
Medicare will pay some amount.
The thing with asking about insurance is something I'm going to give you a phone number for. That's 800-300-9300, and you can talk to the office. Yeah.
Okay. I'm going to ask your office that because my supplement and my Medicare, how much I have to pay for each treatment. And I have the last question.
Sure.
First, you try PRP or stem cell. Which one you do first?
That's a decision that we make by talking to each other. There's too many considerations to figure out what you would need. By just talking to you like this, I have to examine the area.
Okay. Okay, and which city are you at, doctor?
I'm right across the freeway from UCLA. So I'm on Wilshire Boulevard.
Here in Westwood, Wilshire.
Yeah, well, not
Perfect.
Westwood, but West LA, yeah. Right off the 405 on Wilshire.
Very good. I will call your office. Thank you so much.
Nancy, in all the years that I've been doing this radio show, which is like 20 years, I think you're one of the most intelligent people that I've talked to, and I appreciate you calling in, because all the questions you have are questions that everybody else listening has also. So I really appreciate you. I would love to see you and help you on your way to healing.
Thank you.
Thank you, Nancy. We really appreciate it.
God bless you, Nancy. Yeah, thank you.
Bye-bye.
Bye-bye. You're listening to Living Pain-Free with Dr. Marc Darrow, and the number here in the studio for you to talk to Dr. Darrow is 866-870-5752. That's 866-870-5752. And the website is www.lastemcells.com. That's lastemcells.com. And if you go there, you can email Dr. Darrow off of every page on the site, as well as watch him perform the treatments on videos. And when you phone the program today, you get Dr. Darrow's latest book for free. Stem Cell and Platelet Therapy is the title, subtitled Regenerate, Don't Operate. And if you don't know what that means, call the show right now, 866-870-5752, right here in the studio. What do you think?
I just want to mention that in this book, which is free if you call in, Suzanne Summers, I'm showing a picture of her to the video camera right now, is a wonderful advocate of what is called alternative medicine. It's not really alternative. It was here before the traditional medicine showed up. To me, traditional medicine is alternative, drugs and surgery. That's alternative, and it's not needed in musculoskeletal medicine. In most cases, it is needed. In a lot of cases, if you have a broken bone or something like that, you're right. You better go get a surgery real quick. If your leg is dead and you've got a herniated disc that's pushing on a nerve and you're paralyzed, you better go get a surgery right away. But Suzanne Summers wrote the foreword to my book, and thank you, Suzanne Summers. I adore you, and all of us in this line of work adore Suzanne Summers, and that relates to people who are doing things what you call outside the box of traditional medicine. And when I hear the word traditional medicine, I shudder, because there's so much of it that's backwards and actually hurts people. Something as simple as taking too much aspirin or anti-inflammatory medicine can kill people. There's 100,000 deaths a year, I think it is. Or I'm not sure if it's deaths or hospitalizations from people bleeding from taking those medications. And every medication has its side effect. In, quote, alternative medicine, we do things hopefully without medication and without surgery. And people put that down, my God, they should be applauding it. And regenerative medicine is outside the box of traditional medicine, of surgery and drugs, and painkillers and narcotics. We don't do that. So I applaud all of my family of regenerative medicine doctors all over the country, all over the world. It's becoming the rage, and unfortunately the surgeons still own the turf, but they will die out, and we will be the top of the heap in terms of helping heal people without doing invasive things and medicating them. And I don't know where doctors get off giving patients narcotics long term. That's just the worst thing. There is an epidemic of opioids today. And one of the first things I do when people come in on opioids is I wean them off. We're going to break.
We are.
Please stay with us. The phone number to the studio, you can talk to me, 866-870-5752. Give me a call. I'd love to talk to you.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.